Let's talk about some risk factors for a moment that are associated with increased incidence of Alzheimer's disease. They're increase in age, increase in homocysteine level, trauma to the head, lower education, the female sex, family history of Alzheimer's disease, heart disease, and head trauma. Now, when you talk about those, let's narrow it down even further. There's a higher incidence of Alzheimer's disease in the African American community than any other community, and that's because of the disease processes that are also associated with the risk factors for Alzheimer's disease. For example, an African American that has hypertension, 24% increased chance of them getting dementia over somebody that doesn't have hypertension. African American with diabetes, 46% chance of them getting dementia over someone that doesn't have diabetes. High cholesterol, 32% more likely to get dementia if they have high cholesterol. And if they smoke in mid-lifetime, smoking is a significant risk factor, but if they're smoking in mid-lifetime, they have a 26% increased chance of getting Alzheimer's disease. There's some other factors that are also associated with the African American community that would make it more likely for them to get Alzheimer's disease. 80% higher chance of death due to stroke. Well, again, we're back to the cardiovascular system. Higher problems in the cardiovascular system, more likely to Alzheimer's disease. 50% higher chance of death associated with heart disease. Again, we're talking the African American community. 320% higher incidence of having end-of-life kidney disease. Diabetes, being on dialysis. Diabetes doesn't cause dialysis, but many times African American community have a higher incidence of renal failure, which leads to being on the kidney machine. 320% higher incidence of that in the African American community, and there's an association with that, meaning higher incidence of Alzheimer's disease. And the last statistic in this category is about 13% of African Americans aged 20 years and older have diabetes. That's a big deal. What are some of the other factors involved? When you compare the African American to other racial groups, if you compare the African American to Caucasians and Hispanics, increase in blood pressure, high blood pressure, 19% African Americans, 7.3% in Caucasians, 9% in Hispanics. Obesity, 49% in African Americans, 29% in Caucasians, 33% in Hispanics. Smoking, 34% African Americans, 17% Caucasians, 17% Hispanics. When you put all these risk factors together, they add up. The more these risk factors one has, the more likely they are to develop dementia, and that dementia is more likely to be of the Alzheimer's type.